डिस्कस करेंगे एल्बो जॉइंट। द टाइप ऑफ एल्बो जॉइंट, इट इज ए हिंज variety of synovial joint bones that taking part in the elbow joint. There are three bones. First, the lower end of the humerus, then trochlear notch of the ulna, and the upper end of the radius. The elbow joint is a composite joint because it is formed by three bones and because of humero-ulnar and humero-radial joint. The articular surface. The humero-ulnar component, the articular surfaces are trochlea of the humerus, then olecranon fossa of humerus and coronatal humerus, and trochlear notch of the ulna. And in humero-radial component, the head of the radius is the component from radius, and capitulum of the humerus is component from humerus bone. Then articular capsule of elbow joint. There are two parts. First one is fibrous capsule and second is synovial membrane. In fibrous capsule, the lower end of the humerus along continuous line excluding the medial and lateral epicondyle, but including olecranon, radial and coronate fossa. Below and medially, the margin of the trochlear notch of ulna. Below and medially, the margin of the trochlear notch of the ulna. Here you should see it. Notch of ulna, and below and laterally to the angular ligament of the radius. And synovial membrane, the inner lines the inner aspect of the fibrous capsule. Then ligament, the ulnar collateral ligament. It is a triangular in shape ligament. It is a triangular shape of ligament. Its apex is attached to the medial epicondyle of the humerus and base is attached to the ulna. It has three veins. Means ulnar collateral ligament has three veins. First one is anterior vein attached to the tubercle of the coronoid process, and posterior vein medial margin of the olecranon process. Then oblique vein attached to the olecranon or coronoid process. A foramen is present between these three veins, through which intracapsular fat communicate with extracapsular fat. This ligament is crossed by the ulnar nerve and covered with flexor carpi ulnaris muscle, triceps muscle, and flexor digitorum superficialis muscle. Then radial collateral ligament. It is a fan-shaped ligament extending from lateral epicondyle to the ulnar ligament. Then anterior ligament. This ligament strengthens the capsule in the front side, and posterior ligament strengthens the capsule from back. Then bursa present in the elbow joint. Bursa between the triceps tendon and capsule above the olecranon processes. Secondly, subcutaneous bursa on the posterior surface of the olecranon processes. And the third bursa is present between the biceps and radial tuberosity. Then blood supply of the elbow joint, arterial anastomosis around the elbow joint. For this topic we have a specific video, you can see that. And nerve supply of the elbow joint, ulnar nerve, medial nerve, radial nerve and musculocutaneous nerve is supply the elbow joint. Movement of the elbow joint, flexion. Flexion is done mainly by biceps brachialis and brachioradialis, and extension is done with the help of triceps and ancoraeus. And applied anatomy of elbow joint. Dislocation of elbow joint. Due to the weakness of capsule, coronoid process is fractured. The triangular relationship of two condyle of humerus and olecranon process is disturbed and they lie in the same plane. Secondly, tennis elbow. Abrupt pronation of the elbow may result in pain and tenderness in the elbow. This condition is called tennis elbow. Due to injury of radial collateral ligament, tennis elbow syndrome happen. The swelling of elbow joint. As the posterior part of the elbow is weakest, so the effusion occur in the posterior aspect. And pulled elbow. Head of the radius is displaced and supination movement is painful and limited. So the end of the video, I want to say a principle, that is 80-20 principle. It means when 80% of things are give the same result that do the 20% of thing. For example, there are 100% of our country population. The total money of the country will provide only the 20% of the peoples. And then when we have suppose 10 shirt, we use only 2 shirt mostly, but the other 8 shirt will contribute the same that the contribute